The broadcast is now starting. All attendees are in listen-only mode.
Welcome to the AMT webinar, How to Evaluate a Certification Credential from American Medical Technologists. AMT is a credentialing organization and professional society of allied health professionals. In this session, for employers and managers, AMT wants to offer some insights about criteria you might want to use to evaluate a certification. Certainly, healthcare providers understand how a respected credential brings credibility to them as professionals. That's why they use them after their names to identify themselves. While we're all very familiar with MD and DO, it gets less clear when there's multiple credentials for essentially the same role. What do those letters in a credential signify? If you're hiring or managing allied health professionals, you likely have an interest in understanding certifications as well as you understand higher level licensing, because these professionals do have a direct impact on patient care. And not all certifications are created equal. Standards matter. You may have questions today. At the moment, your microphone is muted. For asking questions, we encourage you to submit the questions via the questions box that you can see on the side of your screen, and you can do that as we go along. Our running time for this webinar today with Q&A is about 35 minutes. If you'd like to pose a question verbally, you can use the controls to raise your hand, and we'll call your name and unmute you so everyone can hear you. So here's the we who are on for this session. I'm Mary Spila. I'm a manager with AMT. And now a word of welcome to you from our Director of Marketing and Communications, Susan Rajkovic.
Thanks, Mary. As a relatively new member to the AMT Marketing and Communications team, with my background being primarily in healthcare, I'd like to personally welcome and thank you all for joining our webinar today. We're ready to partner with you and support you every step of the way with our fabulous concierge-style support. Our team will offer you some great insights today. So again, welcome and enjoy, and feel free to reach out to us at any time. Back to you, Mary.
Thanks, Susan. Also with us today is our Business Development Specialist, Christina Cormany. And Christina will be answering your questions as they appear in the questions box. So who is AMT to speak about credentials? AMT was founded back in 1939 by a group of medical technologists who wanted to maintain quality in their fledgling field of lab science. Today, AMT has more than 100,000 actively certified members. They're not all med techs. For 50 years, AMT has been certifying registered medical assistants, and many of our members are medical assistants. We offer 11 separate certifications. And the beauty and the value among AMT membership is the diversity. We have members from 11 different certifications interacting with each other to discuss, learn, grow, lead the industry, and provide the best in patient care. Underlying each certification credential are 3 essential components. They are education, experience, and an exam. And in order to earn any AMT credential, someone has to both meet our eligibility requirements for education, plus experience, and pass a rigorous exam. And AMT dedicates significant resources to ensure that those competencies that people are tested on are based on practical, real-world work. Competencies in the real world, it's the basis of a certification credential. And the image that's displayed on this slide, I think, exemplifies AMT's mission, and that is to serve public health by using best practices to certify that allied health professionals are competent for their specific job. They've met rigorous criteria to prove that they can perform those relevant on-the-job tasks, which is important to the employer, to the health professional, and probably most importantly for the patient. So here's what we'll invite you to consider about a certification credential: its foundation and trustworthiness, the enduring value, and the ethics. So what is the fundamental purpose of a certification credential? It is objective, third-party evidence that an individual possesses the baseline competencies to perform a job. Certification is a seal of approval from a third party. Credentials also give a trusted measure of professional credibility to the public. Once they're earned, the designated letters of one's credentials are placed after their name. And professional credentials are awarded by an academic institution or a recognized professional organization to verify qualifications and competence. And they attest to a formal process and successful completion of criteria set forth by schools and professional organizations. Which means that someone can't create their own credentials by simply choosing letters to place after their name. Using self-assigned letters or acronyms after your name as a way to advertise to the public an implied specialty in one's field is fraudulent. When there's a set of letters in parentheses after the credential, that signifies the credentialing organization. In the example of Chantel Williams' RMA, RMA stands for Registered Medical Assistant, and I've highlighted AMT, that's American Technologists. In this case, AMT stands behind the credential. It gets complicated when there's more than one certification credential for the same job role. For example, for phlebotomists, there are these certifications, to name several prominent ones. There's more than this. And each organization, which is indicated by the parentheses, has its own criteria for awarding a credential. For example, just a partial example of eligibility criteria. For someone to be eligible to sit for the RPT exam, that's phlebotomy from AMT, they must prove 50 successful venipunctures and 10 successful capillary punctures from human sources. For phlebotomy, for ASCP, 100 successful unaided venipunctures. For NCPT, qualify with NCCT, it's 25 venipunctures, 5 capillary puncture procedures. Of course, there's more to eligibility for these certifications, but that's just an example of variation that happens among similar sounding certifications. There's also some confusion about some of the common terms that are used to describe allied health professionals, such as licensed versus certified versus registered. Licensed typically means it's a state-issued credential, whereas certified is often a national credential, but not always. For example, California has a state certification for medical assistants. Registered does mean the same as certified. It's just a different term. AMT offers certification that's recognized throughout the US and abroad. And although some of AMT's credentials bear the designation registered, it's important to note that all individuals credentialed by AMT are considered certified, much like registered nurses or registered dietitians are certified by their respective boards. So registered and certified mean the same. Another confusing terminology is certification versus certificate. Certification is a credential that's typically associated with a professional job or a role, like a certified phlebotomist or a certified patient care technician. It's what they do for a living. The credential holder has to meet eligibility criteria and pass an exam. And with the certification, you get to put credentials after your name, like Chantel Williams, RMA, AMT. A certificate, on the other hand, is more for a task or a component of a job. A certificate's awarded when you do some training and you pass an assessment. You'd get a certificate in something like immunization or in ECG. And in fact, AMT does offer certificates in courses such as these and more. But there are ways for you to judge for yourself if credentials are robust enough for you to hire or to seek out for your employees. And we'll give you some ideas as a gauge. The foundation and the trustworthiness of the credential itself, the enduring value, and the ethics behind the credential. So let's start with first some questions to ask about what is the foundation of a certification? What supports it? And some questions would be asked, does the exam reflect best practices in psychometrics and credentialing? Was it developed and administered using state-of-the-art methodologies? At AMT, this is managed by an in-house staff of psychometricians. And these are the people with deep knowledge of testing for competencies in the field. And both the eligibility criteria and the test questions are overseen by volunteer subject matter experts who work in a variety of practice settings. A good professional certification exam is based on current practices in the real world. The test questions in the exam have to fit a number of criteria. Are they rigorously developed and tested? Exam content must include the depth and the breadth of disciplines. At the same time, they must be entry level because these are baseline competencies. Allow for various cognitive levels. We all think in different ways. Free from bias, of course. Must be validated, have to be based on objective evidence. And of course, they must be relevant and accurate. And all of these items are intellectual property that makes the certification robust and unique. Another important aspect of quality is the exam security. Test security, an essential element in supporting the validity of an assessment. And it also ensures the protection of the intellectual property. So why is security necessary for validity? Well, if a full examination is publicly available through a breach in security, candidates could easily learn the answers to all the questions, making the test invalid. And as a result, the safety of patients or the public could be jeopardized because the person who's believed to possess a certain ability by virtue of their credential may not be qualified. Think about a person drawing blood who doesn't know how to locate a vein for the procedure. Another question about the security of the exam process: is there third-party administration of the exam from a company that is not the same as the certification issuing organization? The exam should be held at a secure site, and that maintains the integrity of the testing result. It ensures that the certificant passed the test unassisted. And maintaining the integrity of the exam, it reflects well on those who take it. And it also protects the value of the certification for our current members and our future members. We want a fair process, so all exam takers have the same opportunity to succeed. What's at risk? security matters to employers. Healthcare organizations that hire allied health professionals are looking for a trusted certification among their staff members because it has a direct impact on the quality of patient care. And the level of security around an exam depends on what's at stake, and credentialing tests like licensure and certification are considered high stakes. Now, here's some considerations about the certification agency. You could ask, is the organization reputable with an altruistic purpose? A not-for-profit professional society is by definition not owned by anybody. Members' fees directly support services, not investors or owners. 501c6 information regarding certification and membership is publicly available. And a not-for-profit professional organization by AMT is member-led, and the board of directors is allied health professionals. And it's volunteer committees of working professionals that are overseeing the standards and practices. Is the exam development process accredited? A respected certification agency is going to have their processes for exam development evaluated and accredited through an independent third-party organization like National Commission for Certifying Agencies, or NCCA. You'd like to make sure that the accrediting organization is nationally recognized and requires agencies to follow the most rigorous standards. Also significant, who does the training to help candidates meet the eligibility criteria? And because certification is that objective third-party stamp of approval, the education is necessarily separate from the certification agency. To help ensure that applicants are going to be well prepared to pass a rigorous exam, AMT accepts applications from education route candidates who've completed programs that meet stringent requirements for instruction and for hands-on learning. Schools must be accredited by the United States Department of Education accepted accreditors or get special approval from the AMT Board of Directors. And each program must attest to certain standards for instruction in order to get their students certified through AMT. To be clear, AMT does accept work experience for some certifications. Those routes vary by requirements and have some combination of training and hands-on experience. Another set of considerations is whether the credential has enduring value. Is it a national certification that can be carried from state to state? Does it make the individual part of a professional organization of their peers? That's a crucial network for support and for education. Are they required to maintain competencies to keep their certification current? And is it reasonable to maintain? Are the CE affordable, easy to find? Can the requirements be partially filled by training that the employer offers? And maintaining a credential is facilitated if they're a member of a professional society where they're supported by peers and can easily connect. There should be plenty of opportunities to find discounted CE that's specifically created to support a particular discipline, whether it's lab or medical practice. So I mentioned that certification exams test for specific skills and knowledge, but does certification matter in more ways? We posed that question to both managers of physician practices and to allied health professionals themselves. Employees told us that they like it because it demonstrates their commitment to the profession and to high quality patient care. They're proud of it. It's a personal career accomplishment that confirms they're qualified. And they often get better pay and are eligible for better jobs and for advancement. And our image here features AMT certified RMA and medical assistant Aubrey Wiggins. Does certification matter for employers? We polled practices. They told us that they like that certification is not subjective. It's testing against a standard, which is unbiased toward any individual. Every single person is assessed fairly and equitably using scientifically sound criteria. Certification reduces the risk of hiring someone who's not a good fit. To maintain certification, staff need to report to AMT how their activities are keeping them current in their practice. It can help with compliance with regulatory requirements. Some state and federal regs require certification to practice. And more, we're hearing that certifications used to assess the skills and knowledge that's required for peak job performance. Most employers do pay a differential to certified individuals. They can do more, and employers often require certification for more advanced tasks. And finally, something we never take for granted, the level of trust we must have in credentialing in support of healthcare delivery. To trust the validity of a credential, you might want to know if every person who applied for the credential truly did have that education and experience that's required. In our organization, staff reviews each and every application to verify the applicant's eligibility rather than simply auditing a sample. It ensures that the work experience and the training took place. Is there a way to verify their credentials? Anyone can check our website anytime to verify a current or potential employee certification status, and that's at americanmedtech.org. To do the search, you do need an AMT ID or a social security number. Is there a code of ethics requirement? Allied health professionals are in positions of trust. Each credential holder should attest to abiding by a code of ethics in standards of practice. If that trust is seriously violated, that individual should be reportable to a judiciary committee of peers and a decision made as to whether the credential should be suspended. Because trust is paramount for a credential, you should expect a publicly available way to report an ethics or other violation of the standards of practice. AMT takes this very seriously because the integrity of credentials is their inherent value. So we recommended a lot of ways to evaluate a credential, but how do you find that information? What are potential sources for reliable or trustworthy information about a credential you might hire? It's the same way you might get information about an individual you might hire. You can ask your current staff. If you like an individual in a role, find out what their certification is, or ask a clinical manager what their experience is with different certifications. Of course, the websites of certification agencies themselves should be reliable sources of information. I personally would be a little leery of third-party sites that offer comparisons of different certifications. The problem is that the information is often incomplete or out of date because there's little incentive to keep it updated. How do you know it's a third-party site? Read the About Us part of the site so you know who is behind the information. Another way to find out about certifications is to check job postings to see what credentials are accepted by healthcare organizations that have made a name for themselves for quality. Many will specify certain agencies for acceptable certifications. Even with the staffing shortages, some of the premier providers will require certification from only a not-for-profit professional organization rather than a for-profit company. So those were some sources for information about certification. Here's a few ideas about how to resource qualified staff who are certified. Externships and apprenticeships are an excellent way to train and evaluate your own candidates. Many new professionals get hired that way. You might consider becoming an externship site for students. While not every school has programs robust enough for AMT certifications, there are many excellent career schools and community colleges and career technical education schools that are preparing students for AMT credentials. These schools need clinical partners to help their students get hands-on experience. Also, it's exciting to see apprenticeships in allied health. They're growing very rapidly. We currently work with organizations that have apprenticeship programs to fill their ongoing staffing needs. There's a lot of innovation in this space and support's available. We'd be glad to have a separate conversation with you to explore apprenticeships. AMT's partnered with organizations and can help you through the process too. Susan mentioned at the outset, we do have concierge style support because different organizations have different situations. And one last note, you don't have to have an apprenticeship or externship program to get qualified staff. For many years, AMT's been working directly with employers and hiring managers to either get existing staff certified or to hire already certified staff. I have just presented a lot of information in a short time. I'm happy to answer any questions. You can put them in the questions box on your screen or raise your hand and we'll unmute you and you can pose your question. One question that we often get is from employers is about eligibility criteria. How do you direct them, Christina, when those questions come up?
Sure thing, Mary. So each of our 11 different certifications, all of our exam-based certifications have multiple different eligibility routes that applicants can qualify under. For a few of the certifications, we also offer self-assessment and eligibility assistance to help them determine their own eligibility. We're also going to be rolling out a few additional ones later this year, so make sure to check out that.
Thanks, Christina. And I see a question with regard to how often do you update your exam or exam review materials? And simply, I would say that I suppose the simplest way to say it is that the exam are in a continual process of renewal. There's information in our candidate handbook about the psychometric processes for the exam, both how the material is created and how it's kept current. And I would encourage you to look at that. Also, the exam review materials are all kept current continuously. And we recommend looking at the exam content outline for understanding what's on the exam. That's on our website for each and every certification exam. There's also resource materials, and for many of our certifications, there are practice exams. There's a question about having a degree in biology, and is there an eligibility route for med tech? And that's an excellent question. Christina mentioned many questions about eligibility criteria. There's a variety of routes because there are a variety of eligible candidates, and we would encourage you to take a look at the routes that are published on the website and discern which best suits your situation. And I would also encourage you, I'm going to display our contact information to reach out to us. And there's our web address, americanmedtech.org, and also our phone number. And if you visit our website, there's a pop-up box if you would like to talk with a representative to discuss your questions. Christina, did we address the questions?
Yes, nobody else has their hand raised either. Oh, there's a new one that just popped up. Crystal says, I frequently use the AMT portal to gather reports and am only able to download reports in Firefox. Will the site be updated to be more user-friendly for other browsers soon? I know that each user has different settings set up on different browsers, so sometimes it helps to clear out internet cookies. I know that Firefox and Edge seem to be the most compatible, but yes, AMT is always working on trying to improve on things to better serve our customers.
Well, thanks, Christina. It looks like we've covered today's questions. If you think of others, please contact our account care team via phone or email. And please don't forget to connect with us on social media. And a recording of today's webinar will be emailed within a few days to the email address that you registered with. As always, thanks for your support of AMT. It's a pleasure to work in partnership with you on behalf of new allied health professionals. And this webinar is ended.